culture and reducing health disparities. Our mission, therefore, is to increase access to quality care through mobilization of our patient-centered community care teams within underrepresented communities and diverse populations. We love our diverse populations here in South Florida, guys. So that's our mission and our vision, guys. Next slide.
Okay, and so based on our investigation, our initial investigation, every year there is a community health needs assessment. And so we have to meet the parameters of that community health needs assessment to find that need and kind of demonstrate that need for funding bodies. And so the 7 parameters were health equity and social determinants of health, chronic disease prevention and management, medical research and health profession education, behavioral health. There's a big gap, and so they saw that that needs to be addressed. Maternal and child health, and access to care. And so based on providing these parameters, we can have quality health care and social services, creating an impact in the community in these counties that we're going to serve.
Yeah, wow, good. So that's the need, guys. Oh.
And so also, based on that community health needs assessment, we then did further research. And so you can see here, the death rates is contributed from stroke, kidney disease, and Parkinson's disease, surprisingly. So these were the highest prevalence rates, and it actually exceeds the benchmark for the state, but also the nation. So that is why it needs to be addressed, and we find that there is a need.
We want to address it. So we do have our experience with patients, Hillary and I, practicing in family medicine. I see a lot of health disparities, like we're saying, so there's a need for many different things. And so we wrote down just bullet points, but there's a lot. So the first thing that we want our patients to have, and what our community needs from their medical providers, they need to be treated with respect and with dignity. So we have a lot of the underserved population. We have homeless people. We have people who might be suffering with substance abuse. And they're not treated with respect in the medical community. I see it all the time. They're often looked down on, or they're often thought of, oh, that person, you know. And so I think that it's important that the same way we all deserve respect, this community that is underserved, they deserve the respect and dignity. And the second bullet point is that they need to be actively engaged with community. Community is where we receive our support. And so I see how my patients, they can decline in their health because they don't have the support system that they need. And so a support system is everything. And feeling a part of a community does a lot for your mental health, and it does a lot for your physical health too. So we're talking about holistic health here. And then to be cared for, to be involved in his or her own treatment and living plan. It's funny enough to see how some medical providers talk at the patient and tell the patient, this is what you need to do. Rather than having a discussion with the patient, like, here's a suggestion of what you can do. Is this possible for you? Let the patient, let the person be a part of their decision making. It's their body, it's their life. They deserve to have a say on how they are going to handle their health needs, right? So we think that that's important.
And as experience in community health, when you see the patient involved with their patient care plan, they're actually more motivated, and they feel like they're a part of the team. So they are held accountable, and they feel that you're their coach. And we saw progress and improvements in their health when that happened.
Yeah. So just a sidebar, we want to be a part of their community. We want to create that community, that environment where they feel comfortable enough to participate in healthy living. And then the last point we put up there, to be cared for by skilled and medically knowledgeable clinicians, caregivers working as a team. So we believe in a collaborative effort. We believe in not just one person that's needed for the job, right?
Yeah, and collaboration is to the extension, as we mentioned, the caregivers. So we noticed a lot of caregiver burnout. As a community health worker, we have to educate the caregivers on resources for them because they're caring for their elderly. They don't know where to go to for the community, or they're just feeling like they need an extra support system. So having them being access to the resource.
Yeah, that's good. So we got a plan, guys. I think, so I'll go over this slide. So our strategic plan, we can go through our plan. We came with these ideas. And so the basis of our foundation is that we want to provide a sliding scale program for the clinic expenses. So you pay based off of your income, or you pay based off of what you can provide. The second thing is to provide screenings and health education, and we want to do that in local health fairs, which, side note, we did one, but we'll get there. And we want to establish, or we want to partner with a program of health navigators, and that's to educate and enroll community members in affordable health insurance, because it's out there, insurance is out there. And then to create a mobile community health program so that we can reach multiple counties, not just Broward.
And so what we want to do is develop a team of diverse and multilingual staff. We want to develop a community care team that's going to emphasize health literacy so that they're understanding their care plan, seeing and meeting them where they're at and coaching them through that. Chronic disease prevention and education, addressing the social determinants of health, obstacles, providing health coaching to increase self-sufficiency. This goal is very important because we want the patient to be self-sufficient. So a lot of times when they're given a care plan, they're dependent on the provider. And then there is a lack of follow-up, they're not held accountable. Patients need to be self-sufficient. They need that coach and mentor to help them be dependent on, okay, I know how to read my A1C. I know where I can go to get a prescription discount for medications and accessing mental health resources. So this is a very important part of our program that is going to make us stand out.
Yeah.
And additionally, providing training to identify and treat drug overdose. That's something that in the future health fairs we are going to provide as well.
Opioid pandemic. We talk about COVID, but opioid is a big crisis in Florida, and the number one death, the cause of death for young adults.
And bridging the gap between inmate release and into society, because that is something that is not looked at all, and so that's another need that we need to address in the future. And so neighborhood medical will provide for the community in these aspects. Adult social care, so in the future having workshops for those people that are suffering from Parkinson's or Alzheimer's, providing education to those caregivers, having activity workshops to keep them engaged, keep them intellectually engaged, more important in understanding their condition.
And then also another clinical service is primary and my bread and butter, preventative care. There's so many illnesses that are preventable. We just got to educate. We just got to talk to people. Tell them, hey, it's not your fault. Like this is your culture. Let's help you. Let's help to prevent you from having a stroke. Let's help to prevent you from having, die from kidney disease, right? and hypoglycemia. So we put on there a list of things, but there's a lot to it. So we put diabetes education. It's very important in our ethnic communities. As we know, all of us know somebody with diabetes. Diabetes education and wellness counseling, teaching them how to check their sugars. What is hypoglycemia? How do you fix that? And how do you avoid that? So that's things that the preventative care team would take care of. Also, non-emergent acute services. So these are things like a common cold, or you have a cut on your finger. And because you don't have a doctor that you've established care with, you go to the emergency room. And the emergency room costs a lot of money. So we want to be able to avoid people going to the emergency room for simple things that could be taken care of by your services.
Establishing a non-emergent care plan in order to avoid emergency services that are not needed.
Absolutely. Oh, and mental health. This is a big thing. I'm a firm believer, and we're taught in school, mental health is so important for your physical health. There's no way around it. And so we believe in mental health. And so we want to create a team, and that includes licensed mental health counselors, licensed clinical social workers, a care team that will help to manage mental diseases.
And lastly, community health workers. So we want these workers to be embedded within the community, going to patients' homes, learning their environment, learning that, this person has some need for reporting services, or this person I see, they are saying that they're eating right, but then there's Twinkies next to the bed. So they're seeing and actually reporting to the doctor what they're seeing with the patient, and being their coach and being their coach alongside the patient, as well as embedding the community health workers within the emergency room. So in the emergency room, there is a lack of follow-up after the discharge, and then they're not going to their primary care for whatever reason. Maybe they don't have the transportation, they don't have that established doctor, insurance, and so it's a quick discharge without someone outside in the community helping them with that follow-up plan. So that's why this could be a differentiating factor for a community care team and for grant funding. So with further investigation, then we looked into startup costs. So we wanted to have a mobile clinic and mobilizing this community care team. So then we looked at, okay, what's the cost of the van rental, the gas, the office supplies, and EMR software. And so that total, just startup cost, could be about $379,000. So we looked at, okay, where do we have to look at in terms of establishing ourselves either as a nonprofit or a for-profit, or how can we demonstrate the need? And so that would bring us to our first community health fair. Woo! Yeah! And so we demonstrated that need with research.